Ah, it hurts.
Hello, happy
Hey.
Halloween. Are
Hey.
you okay?
Not really. My knees hurt a lot.
Oh no. Here, take some candy.
Thank you so much.
Of course.
Thank you.
The next day.
Hi, how are you doing today?
Good. How about yourself?
Good. So what brought you in today, Brandon?
I've been having recent issues with my knees and my hands. It hurts every time I try to move them around and walk a lot. So, is there any recommendations that you have for me based on my history that I have?
Yeah, so it sounds like your arthritis is progressing. I did look over some of your labs and I noticed from x-rays that you have increased soft tissue swelling of the knee joints. I also reviewed your synovial membrane biopsy and it revealed increased inflammatory changes. Your CBCs are elevated, showing that the inflammatory process is occurring. So this is a little concerning because now you're moving on to the more chronic phase of your rheumatoid arthritis. This constant elevation is what causing you so much uncomfortability and is what is causing your signs and symptoms that you presented here with today. I know in the past we have given you oxycodone for the pain and methotrexate for treatment of your chronic rheumatoid arthritis. Since the methotrexate is not working, we can move you up to something a little stronger. I'm going to put it in order for Rinvoq, a stronger immunosuppressant that is typically prescribed when the methotrexate does not produce desired effects. This medication should hopefully produce some better effects for you and hopefully get you feeling a little less pain, a little less inflammation. This medication, like I said, should bring on those effects. Some symptoms you need to watch out for and be aware of are that it could increase blood clots, could cause some upper respiratory infections, and severe nausea. We'll monitor these things as you take it, so don't worry too much on that. With this, I'm also going to prescribe you a low-dose antidepressant called paroxetine, which is typical for chronic rheumatoid arthritis patients. We like to give a low-dose antidepressant just because the pain can be a little much. This medication can cause some symptoms of headache, dizziness, and nausea, so be aware of that while taking it. Again, we'll monitor these things and make sure you're comfortable taking it if it is something you decide to go forward with. Knowing that you are struggling with the pain though associated with the arthritis, I would also like to talk to you about some other possible therapies out there that I think could be really beneficial to your case, especially that you're really complaining about the pain and uncomfortability. Have you ever experienced or have you ever considered using marijuana and its medicinal properties to treat your chronic arthritis pain?
I've never thought about that. I should give that a try and see if it works because I tried many medications and nothing has worked for me. And maybe cannabis could be an option for me as I'm really irritated by feeling this pain on my bones. And I just want to spend my last Halloween, free of pain, being able to go trick-or-treating. That's just one thing I want to do in my life.
Yeah, well, we can definitely see about getting you a prescription for that.
That would be great.
Note that due to legality issues associated with cannabis and its long history of it being criminalized, there has been limited studies available on its overall effectiveness throughout the body. However, new evolving studies are occurring to better understand how it works within the body. Associated with the use of medical marijuana is its effects of reduction of pain. In studies that were done to determine how medical marijuana is effective against pain, patients who had reported a level of 8 or 9 out of 10 in pain had a reduction of pain down to 2 to 3 out of 10 following the use of medical marijuana. It also provides anti-inflammatory effects. For patients who have chronic arthritis, it helps with the reduction of inflammation within the joints and also helps with pain reduction. Medical marijuana use also provides stress and anxiety relief and improves sleep for patients who experience insomnia. It also improves appetite, increases focus and concentration, reduces depression, and medical marijuana is generally tolerated, and there has been no serious adverse effects that were reported.
Cannabis is one of the world's oldest cultivated plants. The word cannabis refers to all products derived from the plant Cannabis sativa. Its use dates all the way back to 2600 BC, and it was used to treat up to 100 different conditions. Emperor Shang even had it included in his pharmacopoeia, which you can think of as something like our present-day drug guides. He is known as the father of Chinese medicine, and he strongly believed in the plant. And clearly he was onto something. It's used for a wide variety of reasons, like epilepsy, nausea and vomiting associated with the chemotherapy for cancer, loss of appetite and weight loss, which is associated with HIV and AIDS, and it's also used for chronic pain and MS symptoms. Typically, it's used as a last resort for patients whose pain is uncontrolled and they're seeking relief. Cannabis comes in a wide variety of options, both smokable and non-smokable forms.
Okay, great. So I'm going to go ahead and check with my coworker and see if we have any pre-rolls in the back. Can you go check in the back and see if we have any pre-rolls? Yeah, let me go check. Okay.
In the meantime, can I pay?
Yes, of course. So it's going to be $4.20.
420.
Yes.
Okay. Man, price is gonna increase.
All right.
We have it, so
Yeah. Good. Great. Here you are.
Thank you so much. I
Of
appreciate
course.
it.
Come back to Cannabis Clinic.
Definitely. Thank you.
Of course.
Have a good
One
day.
eternity later.
Oh, feels good to be home. I'm gonna smoke this joint that my physician recommended me. Let me get my lighter. Oh, wrong way. Feeling a bit lightheaded.
Oh, yeah.
Whoa!
Can I try?
Oh, where do you come from?
I know how to blow.
Oh gosh, I'm feeling a bit weird. I have to call my doctor. Hey, doc. I've been trying to get a hold of you, but you haven't been answering your phone call. I'm seeing things recently. I feel lightheaded. Do you think there's something wrong with me, or what do you think could be the possible effects that's happening to me right now?
Hello? Oh, hi, Snoopy J. Uh-huh. Okay.
I'm seeing things recently.
Well, that's normal. Some signs and symptoms of marijuana is hallucinations, sleepiness, lightheadedness, and increased hunger. This is your first time trying it, so you may not be used to these symptoms yet, but give it some time and you'll get used to it. Maybe next time, just try a little bit of a lower dose. It sounds like you might have done too much.
Avoid cannabis use when under the age of 18, pregnant or breastfeeding, or if you have a history of psychosis or bipolar disorder. Many doctors never receive training about cannabis's medical benefits, and it may be challenging to find a healthcare provider who is knowledgeable and supportive of your cannabis use. The Society of Cannabis Clinicians maintains a provider directory to help patients find the support they need. If you or someone you know struggles with substance abuse disorder with cannabis, contact Smart Recovery, the Substance Abuse and Mental Health Services Administration, and the National Institute of Drug Abuse.
Hey guys,
Hey, Snoopy J.
how are you guys doing?
Good. You look like you're walking better since the last time I saw you.
Definitely, I was having issues with my arthritis, and so I made an appointment with my physician. She recommended me some cannabis.
Oh wow. How's your pain doing now?
Oh, it's much better now. I
That's
was
so good.
having so much pain. Are we still going trick or treating?
Trick or treating?
Yeah,
Cannabis is helping you that much? You think you could come with us this year?
it has definitely helped me out so much.
Well then,
If you guys are
let's
still
go.
doing it. Well, let's go.
Let's
Yeah.
see what this weed's doing to you.
Many months later.
Trick or treat.
Hi, happy Halloween. I remember you
No
from last
way.
year. You look so much better now.
Thank you so
Wow.
much. Well, I started taking cannabis.
Oh wow, that's great. I take cannabis too.
Oh,
Yeah, it helps me with a lot of my pain. How about you?
it's been helping with my arthritis.
Oh wow, that's so good. Yeah, see you next year.
Yeah, see you next year. Thank you so much.
Bye.
Get your cannabis now.
Ask your primary care provider if cannabis is right for you. Some side effects include feeling too high, nausea, dizziness, mental fog, paranoia, and increased thirst and hunger.